Just figure it out then.
It largely relies on a careful assessment of your symptoms, looking for those characteristic patterns we discussed, and crucially, ruling out other conditions that could be causing similar symptoms. The main diagnostic guide used is the Rome Theta criteria. Essentially, doctors look for recurrent abdominal pain happening, on average, at least 1 day a week in the last 3 months. And that pain needs to be associated with 2 or more of the following. It's related to having a bowel movement, it's linked to a change in how often you have a bowel movement, or it's linked to a change in the form or appearance of your stool.
So it's about the pattern of symptoms over time, not just a one-off bad week.
Exactly. It's about establishing that chronic pattern. This involves a detailed medical history, talking through symptoms, diet, stress, family history, and a physical exam.
But what if there are signs that maybe it's not IBS or something more serious is going on? Our sources mention red flag symptoms. Why are those so important to identify?
That's a critical distinction. Because while IBS is uncomfortable and disruptive, it doesn't cause long-term damage or lead to more serious diseases. But other conditions can. So red flag symptoms are warning signs that need further investigation to rule out other possibilities. These include things like symptoms starting after age 50, any unintentional weight loss, rectal bleeding or blood in the stool, persistent fever, or unexplained iron deficiency anemia.
Okay, so new onset later in life, weight loss, bleeding.
Right. Also, a family history of conditions like inflammatory bowel disease, Crohn's, or ulcerative colitis or colon cancer. And another one is nocturnal symptoms that actually wake you up from sleep. IBS pain usually doesn't do that. Finding these red flags is crucial because it prompts doctors to look deeper to be sure they're not missing something like IBD, celiac disease, infections, or even cancer, though that's much less common.
So if those red flags appear, what kind of tests might someone expect?
To rule out other conditions, a doctor might order various tests. Blood tests are common, like a complete blood count, CBC, to check for anemia, inflammatory markers like CRP, and tests for celiac disease. Stool tests can check for infections or blood, and importantly for a marker called calprotectin, which can help differentiate IBS from IBD, as it's usually high in IBD but normal in IBS. Sometimes a hydrogen breath test might be used, maybe to look for SIBO, small intestinal bacterial overgrowth, or lactose intolerance. And then more invasive tests like a colonoscopy or sigmoidoscopy might be recommended, but usually only if those red flags are present, or